Hey guys, my name's Sam, and I decided to do my presentation on low back pain. So, exactly what is low back pain? Many of you have maybe experienced it, have seen someone that has had it, but basically it's just pain, stiffness, or muscle tension that is localized below the ribs above the glute max. So, there are three categories of low back pain, which are acute, subacute, and chronic. So, with acute and chronic being the more common ones. So, let's take a look. How common is low back pain? Very, very, very common. 8 out of 10 Americans will have low back pain. Like I said before, I'm sure all of you have maybe experienced low back pain. I think low back pain and back soreness are two different types of things. If you're in a weight training and you maybe just deadlifted for the first time in a couple of weeks or months, you are gonna have a sore low back versus the pain as if you did something else that might have caused it that we'll talk about a little bit later. But basically, we always see chronic cases being the more common. So if you take a look at this chart over here, this is just basically saying talking about the low back pain, more frequent, severe low back pain that's seen, between all the ages, and low back pain with work. So with the dark blue being more 18 to 29-year-olds, green being more 30 to 44-year-olds, and light blue 45 to 64-year-olds. So I thought this part was pretty interesting here. Looking at the work low back pain, the light blue is more common. Basically, I'm thinking because the older population has been working at their job much longer, whether that be, if it's more strenuous activity that they are doing, rather than the younger population may have not had that amount of time working at that job. So that's why the older population is experiencing more back pain and more prevalence here. So I just thought this was pretty interesting, just to give you guys a good idea of how common it actually is. Put that there. So let's look at the causes, risks, and risk factors. So there are tons and tons of causes and risk factors, such as age, genetics, weight, sedentary lifestyles. Pain is complicated. It's usually a multifactorial problem, but with persistent pain, besides structural and mechanic issues, we need to consider stress. We need to consider the forces across a joint, deviations, and beliefs. So there are, stress, anxiety, depression could also cause pain, but more severe causes of low back pain, such as spinal stenosis, disc herniations, a lumbar strain, weight training, sports injury. There are so many causes that can cause a low back pain and the pain that any of you may be experiencing. So let's take a look at the exercise response. So first, how does low back pain affect exercise? Well, being inactive, being on bed rest. There are so many people that are afraid to exercise and have the fear if they move, a wrong way, or if they do an exercise the wrong way, is going to make them worse. But then there's a lot of people that may not be educated and may not have the knowledge to know what to do. Okay, well, I have this low back pain. I don't know what to do to get rid of it. I don't know how to help it. So I work in a physical therapy clinic, and there are so many clients and patients that come in that have low back pain that don't do their home exercises at home, and then they just come in for the therapy, then they go home, they're very inactive, they're sedentary, and then they expect to just get better. While 2 days a week in therapy, that may just make the symptoms worse than it usually does. So it isn't until after a certain amount of time, when they're in the therapy and they get a hold of their home exercise programs and they're doing their stretches and their exercises on a daily basis, then they really start to notice a difference, and they're kind of mad at themselves that they didn't do it earlier and they didn't educate themselves earlier. So the exercise effects on low back pain, it improves it basically. So it helps strengthen the surrounding muscles and reinforces spinal alignment and core recruitment. And it improves the mobility, which can also help move you better. Lastly, it releases endorphins. Exercise makes us happy. So endorphins are chemicals produced by the nervous system to cope with stress. They act as pain relievers, happiness boosters. So exercise does this to us, so why not feel happy when you're trying to do it? And also eating chocolate does this as well. So keep that in mind for all of you chocolate lovers. The next slide is I'm going to move my slide. So this is a chart. Basically, like I said, a lot of people aren't educated on what to do if they have low back pain, so they resort to painkillers. And this is a list of like how everyone has dealt with their back pain. This is weight reduction, stress reduction, change of the diet, but the number one thing is painkillers. And some of them may just think it's a magic pill that's going to get rid of the pain. A lot of the times it'll just do that temporarily. But over here, I have therapies that can help manage low back pain, and notice exercise costs nothing. So compared to spinal manipulation, massages, acupuncture, of course, those cost money, but exercise doesn't cost anything. Your body is the best machine. You don't need all these fancy machines to hop on to help alleviate that back pain. Start off slow, start off simple, and start with moving your body. There's also looking at physical therapy, of course, that costs money, but there's a lot of clinics that offer free consults for people that they just want to come in, talk to a physical therapist, tell them about the condition that they're having. The physical therapist will give them advice and exercises on how to help alleviate that pain. So I think that's a really cool idea. I really do. Instead of spending that money going through insurance, that can be a big discussion. But other than that, the number one thing is exercise doesn't cost anything. Next, looking at medications and meds. So how do they affect the exercise response? Tylenol, very common. It relieves some pain, but it tends to be more gentle in the stomach. Since it damages the liver, doctors advise 3,000 milligrams a day. I think the normal dosage is 4,000. Looking at aspirin, ibuprofen, Motrin. Again, this can cause nausea, heartburn, and stomach pain, but these are very common. You don't need a prescription to get them. They're alternatives to Tylenol, and they help fight swelling. Muscle relaxants. So these can also cause dizziness and drowsiness, and these medications help to ease the spasms in the muscle if one is having them. Moving on to antidepressants. So antidepressants are more for clients and patients that are having more neuropathic pain, such as pain shooting down their legs, such as sciatica. But this can also cause dizziness, drowsiness, dry mouth, constipation. So there's so many symptoms that these medications can give you. And so if you take these medications before exercising and you're feeling very drowsy and dizzy and you go to hop under a squat bar and you go and try and squat, I don't think that's very safe. You will definitely hurt yourself. And a lot of other of the symptoms or the side effects can affect your heart rate and your breathing, which will inhibit the exercise response. So a lot of these things you need to be careful of considering taking these for your low back pain. Also, heat and ice application may alleviate the pain. Definitely with heat, vasodilates the blood vessels. So before exercise, you can kind of do this just to kind of loosen you up. And then the ice application vasoconstricts your blood vessels. So that also will help after exercise, alleviating the pain. So I've done some research, and like I said, many people think that rest and inactivity will solve the pain, and in reality, it's just going to make it worse. You're going to make your life more hectic. So research shows that those who are more active with low back pain have faster recoveries. So I have a video for you guys to watch, and this is just going to kind of go off of my bullet points. So I just thought that video was really interesting and gave you guys more of an idea that restriction of activities can lead to worsen of the symptoms. So moving on, my case study, I decided to do my dad. He's a 44-year-old male. He does have chronic low back pain. He has for years. He's so active. He's not sedentary whatsoever. He's very active in his job. And when he's not working, he's constantly doing something on the house or projects or whatever. So he's doing a lot. So over here, exercise testing, we just did some at-home tests because we had the ability to. So I said, why not? And then the exercise prescription, and I'll talk about this in a later slide, but continue to stay active, take time to stretch and do exercises, low aerobic intensity such as walking and biking and swimming. So basically, anyone that has low back pain should follow the healthy general population, but if the low back pain is more serious, such as possibly cancer, guidance should be based around that condition, such as spinal stenosis and disc herniations. Cardiorespiratory fitness. Tests, submaximal tests are reliable and valid, but the pain may limit the testing. Again, still treated and guided like the general population. Muscular strength and endurance. Anyone with low back pain is going to have a muscle imbalance, trunk deficits, and neuromuscular imbalances. So it all depends on the condition. It all depends on the intensity of the pain, and it could be limited by the fear that person may have. Possible tests can include hyperextension machines, any selected machines, and isokinetic dynamometers. Moving on to flexibility, again, it should be guided by the same as the general population. Stretches could make it worse, though. So, while stretching provides a pain relief effect, it's not necessarily part of the plan that, that someone experiences low back pain. Tightness is a sensory perception rather than an actual limitation, but I do think that some flexibility should be in there. It should just be prescribed correctly. Aerobic, low intensity, and then moderate to high intensity, depending on the condition. So, exercise prescription, like I said, staying very active, including all those 5 components of fitness, and it needs to be individualized for that person. So I went on and I kind of made a little exercise prescription for my clients. So risk factors or stratifications and the programs, breaking it into strength, core stability, and coordination. And on other days, focus on more endurance exercise paired with low intensity exercise. And just kind of give that person a list to do to alleviate the pain. So modifications and special considerations and recommendations. Again, depending on the condition of spinal stenosis, walking may make it worse versus if someone just has acute back pain, walking may alleviate the pain. So again, it all depends on the person and what they're experiencing, but limit activity that makes your symptoms worse. If you're doing something, you're doing a specific activity, and it's literally killing you, don't do it. Refer yourself to get a medical attention and get their advice and see how they can modify it for you. And again, these are just some of my conclusions. My conclusion, key takeaways: exercise is medicine, so stay moving, but receive the correct medical attention depending on the condition that you may have. Again, tackle the cause, find out what the root of the problem is, seek medical attention if you need. Sleep also helps. Sleeping on your back, that way your pelvis is neutral. That'll also help alleviate some pain and get the correct nutrients for your body. Food definitely helps to, whole foods, providing your body with the best kind of food definitely will help healing. So that is my presentation for low back pain. I hope you guys learned something, and I hope if anyone is experiencing low back pain, this definitely helps. So thank you for listening, and here is a list of my references.